Let's talk about a strange and frustrating kind of pain, the kind that sticks around long after an injury should have healed. This is the bizarre world of neuropathic pain. It's a chronic condition that actually comes from damaged nerves themselves. It's a huge medical mystery, and today we're going to unravel what's really going on. So, just how big of a problem are we talking about? Well, take a look at this number. Studies in Europe suggest that a whopping 8% of the entire population is dealing with some form of neuropathic pain. This isn't some rare thing. It's a massive challenge that gets in the way of people's sleep, their work, their entire lives. For some, the experience is so relentless that it's been given a pretty haunting nickname. This is what some people call postherpetic neuralgia. That's the chronic pain that can show up after a shingles infection. It's called the undead cancer because the pain just refuses to die, sometimes lasting for months or even decades long after the shingles itself is gone. It's a really powerful way to get across just how severe and stubborn this can be. Okay, so let's get to the heart of this mystery. To really figure out why this type of pain is so incredibly hard to treat, we first have to know what it is and what makes it so different from the everyday pain we've all felt. Right, so think about the pain you feel when you get a cut or a burn. That's a useful warning signal coming from healthy nerves. Neuropathic pain is totally different. It's not a warning from your nervous system, it's a problem with your nervous system. Essentially, the body's own wiring has gone haywire, and it's sending out completely faulty pain signals. And this nerve damage can be set off by a whole range of things. It could be a complication from diabetes or shingles, or maybe the result of a serious physical trauma like a spinal cord injury. It can even be linked to things like cancer and stroke. This sheer variety of causes is a huge part of why managing neuropathic pain is just so incredibly complex. Now, to really understand why neuropathic pain can be so persistent, we have to dig a little deeper. We need to look at the biological clues and see how the body's own alarm system can turn against itself. So, the problem often kicks off right at the source of the injury. It's a process called peripheral sensitization. Here's a way to think about it. Imagine the nerve endings at the site of the damage are like a smoke detector. Normally, it only goes off when there's a real fire. But with peripheral sensitization, that smoke detector gets faulty. It becomes so sensitive that now even a tiny bit of steam from making toast is enough to set off the full-blown alarm. But it doesn't stop there. The problem can get even bigger. It can escalate to what's called central sensitization. Now, if the nerve ending was our faulty smoke detector, the central nervous system, your spinal cord, and your brain is the fire station. With central sensitization, the fire station itself starts getting jumpy. It starts believing every single false alarm from that busted detector, and it begins sending out fire trucks for absolutely no reason. It amplifies the pain signal and just keeps it going, long after the toast is gone. So let's look at this side by side because it's so important. On the left, you've got peripheral sensitization. That's our faulty smoke detector right at the injury site. And on the right, you have central sensitization. That's when the central command, the fire station, goes on high alert, amplifying and repeating these false signals. What this means is the pain literally gets embedded into the very system that's supposed to be perceiving it.
And as if that whole situation wasn't bad enough, there are accomplices. See, we have these things called glial cells. They're normally just the support crew for our neurons, but they can get activated by all these constant false alarms. And when they do, they start releasing inflammatory stuff, which is basically like pouring gasoline on the fire. It helps lock in that chronic state of pain.
Okay, so given how incredibly complicated this all is, it's probably no surprise that treating neuropathic pain is a major challenge. So let's take a look at the weapons we have today and try to understand why they often fall short when fighting this complex foe. Now, the first line of defense is usually medication, but it's really a story of trade-offs. Sure, antidepressants and anticonvulsants can sometimes help, but they often bring a host of side effects. Opioids? Well, because of the risks, they're typically a second-line option. Even something as common as an NSAID is controversial for long-term use. The 5% lidocaine patch is a good targeted option, but the hard truth is that there's no single drug that's a perfect solution for everyone. So when the pills just aren't cutting it, doctors might turn to more direct, hands-on therapies. This usually follows a kind of escalating ladder. It starts with something like a nerve block to temporarily numb the area. If that doesn't work, they might use electrical pulses to try and reset the nerve. They can even go so far as to permanently destroy the nerve pathway. And at the top of that ladder is often spinal cord stimulation. Spinal cord stimulation is pretty wild technology. It involves implanting a device, kind of like a pacemaker for pain, that sends electrical currents to the spinal cord to basically scramble or mask those pain signals. I mean, it's been used for over 50 years and has helped tons of people, but it's a major surgery and it absolutely comes with serious risks, like infection or, in some rare cases, even causing more injury to the spinal cord itself.
So all of that brings us to a new and much more hopeful chapter in this story. Because we're faced with the limits of our current treatments, scientists are now exploring a whole new frontier, one that looks beyond just blocking or masking pain, and starts thinking about actually healing the damaged nerves and completely rewriting the rules of recovery. And leading the charge on this new frontier are stem cells. What's so amazing about them is their unique potential. They can make more of themselves, and they can transform into almost any kind of specialized cell our body needs, including the very nerve cells that are at the root of neuropathic pain. And that potential translates into some incredible promises for treatment. I mean, we are talking about therapies that could work fast and have long-lasting effects. Stem cells seem to be able to travel directly to the site of nerve damage, release substances that actually promote healing, and actively fight the inflammation that keeps that pain cycle going. This is a huge shift from just managing symptoms to maybe, just maybe, reversing the damage itself.
Now, it all sounds almost too good to be true, right? And that's exactly why we have to hit pause and ask the really critical question. This is an exciting new field, but it's very much still in development. So, what are the big hurdles we need to clear before this can become a real-world option for patients?
Well, the challenges are pretty significant. Researchers are working hard to figure out how to get enough of these cells to the right spot without the body's immune system rejecting them. They also have to make sure the cells don't wander off into the wrong tissues. On top of all that, they're trying to nail down the perfect type of stem cell to use, the exact right dose, and the safest way to deliver them. These are really complex problems that have to be solved before this therapy is ready for prime time. You know, stem cells aren't the only innovation in this regenerative space. Another approach that's gaining ground is called platelet-rich plasma, or PRP. With this therapy, doctors take a patient's own blood, concentrate the platelets, and then inject that concentrate right at the injury site. The whole idea is to use the body's own natural healing factors to calm down inflammation and kickstart tissue repair. So we've really been on quite a journey here. We went from trying to understand this mysterious, debilitating pain to unraveling its complex, faulty wiring. And now we find ourselves on the edge of a major paradigm shift, moving away from just covering up symptoms and toward a future that's focused on real, genuine healing and regeneration. Which leaves us with one final, really profound thought. Pain is one of the most basic parts of being human. It's supposed to be a signal, a warning, a teacher. But for millions of people with chronic neuropathic pain, it's a prison. So the question is, could this new frontier of science, this focus on healing the very source of the problem, ultimately redefine not just how we treat pain, but our very relationship with it?